hosting of us, but also this is your first time in the chair, so welcome. If you've got some words you want to share, we're ready.
John.
Got this assignment.
I'll give you an email address later.
Well, thanks for being here. I know there's the tradition of, I heard it was dad jokes, but someone said bad jokes. I'm not quite sure, but I think I'll probably hit both. So I want to start with those. There's certainly a healthcare theme that started. My first is, so the plague, COVID-19, and the flu walk into the doctor's office, and the doctor turns and says, "Is this kind of a sick joke?"
That was way better than mine.
So the doctor walks into the room and says to the patient, "I've got good news and I've got bad news. Which would you like first?" And the patient says, "Good news." He said, "Well, you're about to have a disease named after you." And then my last one is, what do you never want to hear after your prostate exam? Okay, the doctor's about to come in.
I'm afraid everybody that comes up here is going to want to tell jokes, so we're going to have to start throwing in some comedy. That's fair. So Kevin, this is your first time here with us in an official capacity, and I know there are some in the room, I take that for granted, that don't know you and haven't had the opportunity to meet you. So if you could just tell us a little bit about yourself to get us started, and then introduce us to some of your team.
Sure. So I think the most important thing to know about me is my wife Beth and I have been together for 35 years, married for 33 years. Our kids are 30, 27, 22 boys. Two of them are still on the payroll. One of them is off the payroll. They're all happy and healthy, which is two of the three, most important things as a parent. My background, is really healthcare. In fact, we had an event within, the health system the other day where we all had to introduce ourselves and speak to our years of service in healthcare, and I had to count it up. And when it came around to my time, I said 38, and I couldn't believe I actually said that because it doesn't seem like it's been 38 years since I started my career. But most of my career has been, with large health systems, like Emory Healthcare. I was with Penn State for 10 years. I was also with a national company, in across 28 states. I spent time in West Michigan running a 10-hospital health system. So a good theme of my career has been large health systems, areas that were struggling, and how do we get those areas, to start performing better, and to really inject optimism and an idea of how do we do better, while growing, and fulfill the commitments that we make, to the community. So it was almost a year and a half ago that I got a call from Dr. June Lee of Emory Healthcare asking if I wanted to play a part in their idea of becoming a part of the Warner Robins and Perry community and acquired House and Healthcare, and I said, you bet. So anyway, I want to welcome our team here. We have, I'm not going to be able to go around and get to everyone, but we've got a number of folks from our board here. We've got a whole bunch of people from our House and Healthcare team that are now our Emory colleagues, but I also have some new folks that brought to the community, and I'd just like to take a quick moment to introduce them, because I think most of our other folks are folks that you've already met before. I want to introduce, and I think we have some photos here.
Yep.
Michael Kober. Michael is our Chief Operating Officer. Michael, if you wouldn't mind standing and just saying hello. So, Michael, like me, has had a career of running health systems, and has come to us most recently from Northeast Georgia, where he was the Chief Operating Officer. And Michael, has really hit the ground running. He joined us in July. And then I'd like to introduce Dr. Kathy Glass. Dr. Kathy Glass is our Chief Medical Officer. Kathy, if you wouldn't mind standing. Kathy is a cardiac anesthesiologist. She is a professor emeritus of Emory School of Medicine. Kathy has served in many senior roles. It was very important for me to have a senior, well-respected female leader, that really has the total confidence of the entire medical community within Emory Healthcare. And Kathy joined us in mid-August, and she's hit the ground running as well. And then our Chief Financial Officer is not here. He's on vacation, which means I got to choose his photo. As you can see, Mike gets distracted. But Mike is really our turnaround CFO. Mike spent nearly 30 years at Yale New Haven. He became sort of the firefighter, so wherever there was a problem, they reassigned things for Mike as the CFO, to help get things back on track. Mike most recently was in Jupiter, Florida, where he helped turn around that health system. So I saw some of the phones out capturing this moment, so Mike will actually see what all of you have seen in terms of his introduction. But anyway, that's the team. It's a team that we've put together for the purposes of really bringing more to this community, delivering on the promise of having a sustainable, thriving health system. We see no reason why the health system in this community shouldn't be thriving, and that's really our goal.
Yeah, well, we're very excited. It definitely sounds like you've got the right team assembled to achieve that goal, and that goal is what everybody in this room is hoping for our healthcare system. So I know before you were brought onto this, you were aware of some of the struggles with Houston Healthcare that they were experiencing, and I'd love it if you can just share with us your thoughts when you arrived and assess the situation here.
Yeah, sure. So I think when Dr. Lee and others first took a look at whether or not they wanted to participate in the acquisition of Houston Healthcare, initially the thought was it's not the right time for Emory to do this. Emory was just coming out of its own financial turnaround, and there was a question as to whether or not taking on an organization that needed significant investment to be able to really right itself. It was the right time, and they took a double look, really at the community, and saw a community that is growing, a community that has done a wonderful job investing in itself, saw a public school district that's second to none, and decided that this was an area of Georgia that it just couldn't pass up. So that's really how Emory decided to become involved. It was much more about the community than it was the health system, to be honest. It was a community that Emory just had to be a part of. Acquisitions take a long time. So it was about a year and a half from the time in which Emory decided we're going to look to get involved, to then get to a letter of intent, to then go through the regulatory process, to go through the due diligence. You can imagine the due diligence of a health system's rather extensive. Probably went through thousands and thousands of documents, community interviews, and talking to different constituencies, getting to know medical staff leaders, board members, all of those things. And we knew that there was a financial turnaround that needed to take place because I don't think I think most people knew that Houston Healthcare was struggling, but I don't think they knew to what extent. And Houston Healthcare had been losing over $35 million per year for at least 5 years. So that was reaching a level of unsustainability. So we knew that coming in that we were going to have to, inject a fair amount of investment to turn that around. We also heard loud and clear that there were things that the community wanted to be fixed. So there were two things that we heard, up front, that were priorities. One was the 911 ambulance response, and the other was the emergency room. The 911 emergency response, before we arrived, I got a call from Dan Perdue. I think Dan is here. Thank you. It's a service that we provide on behalf of the county, and we had heard that the response times, were getting to the point in which complaints were coming from the community, complaints were coming from first responders, that the community needed to have a better response, to the ambulance services. So much so that there was the belief that the state was going to launch an investigation, into the 911 response. So that was an area that we knew we had to fix. In fact, we jumped on it even before we were here. Brought a group together, including folks, from the county, and decided that we had to bring resources immediately, to fix that problem. I'll come back to that in a minute.
Okay.
You asked me about surprises.
Yeah.
Right? So I think there, were, several. One, on our first day that we started here, we lost eligibility to a federal program for drug discounts. And it's technically called the 340B program, which allows you to buy drugs at a significant savings, and it's dependent upon the percentage of indigent care that you have. And there were some decisions that were made over time that watered down that threshold that the federal government looks at. So on day one, we found that we were losing about $7 million per year, of benefit. So our plan coming out of the gate got behind schedule by about $7 million. We think we'll restore that, but that was a big surprise, for us. I think the other big surprise that we had, we knew that the organization had gone a long time in what I would call a resource-deprived environment, and they'd gone a long time, perhaps too long, without adequate resources. And with that, you often find a workforce, that is in some cases losing hope. I think the biggest surprise for all of us and the team that has come here, is despite that environment, there's tremendous talent, in the system. In fact, we think that the talent within house and healthcare, Emory, Warner Robinson, Emory Perry, really, if you use the boxing analogy, is fighting way above its weight class. So we were really surprised to see, the level of talent. However, we also know, that if you're in a resource-deprived environment for too long, right, you can start losing sight, of what good looks like. As a new leader entering into an organization, you always look for opportunities to speak to what will good and great look like as we set forward, from this moment on. In a turnaround, a leader comes in and points back to what good and great looks like and says, this is how we're going to get back to that. The resource deprivation in this health system went on so long, we have a generation of employees that I believe never knew or never saw what good and great looks like. So to find the level of expertise, and talent that we have is a great surprise. And then the last surprise, that I'll point to, and it's something that the community told us, loud and clear as well. When we look at how the community views us, we tend to look at what's called likelihood to recommend. So on a scale of 1 to 5, would you recommend us? Right? We also don't just look at the raw score. We look at what's called the top box score. So what's the percentage of people that will rate us a 4 or a 5? Today, about 7 out of 10 people rate us a 4 out of 5, or a 4 or a 5. Doesn't sound too bad, but that's the 12th percentile in the United States. And that's a level, that I don't think this community wants to see. In fact, the community deserves better. And that's something that, we're really, focused on. I think we were surprised, to see, the level, of, response that we're getting from the community. And it's created a platform for us, internally, as well as, focusing in on the things that we need to, fix the most, so.
Yeah. Well, I know everybody is excited to have you here, and you've clearly identified some of the challenges and struggles as you've been in this first 90 days of discovery. What are steps that are being taken to address some of those, and maybe perhaps some small wins that you've already seen?
Yeah, so the first thing is that, we're going to bring, a lot of resources to the table. So, Emory is allowing us, about $150 million in capital to spend over these next couple of years. And the idea is invest in, really the startup of the turnaround, and then be able, to get the organization, to, really start investing, in its own, future. That $150 million in capital is going to essentially go to 3 things. It's going to go to a brand new electronic health record. We're installing a new health record. I know we're going to talk about that, in a minute. But that's a major investment. That's about $60 million. Something that we've already started and that we'll be implementing, by June 1st. The next, area, is, really going to be investing in our infrastructure. So as you can imagine, losing $35 million a year for, 5 years or more, you get behind. You get behind on critical infrastructure, things like air conditioning, things like elevators. So, we will be spending at least $12 to $15 million, a year in, infrastructure, and we will never get behind again. We have to catch up first, and we'll never get behind again. And then the last is we have to invest in growth. We have to bring more services to the community. We have to fill in the gaps. There's several gaps, of healthcare that needs to be, filled in. And we need to fulfill our vision, which is that, today this community exports more healthcare than it brings in. So we believe that this should be the hub of healthcare for Central Georgia. So we have to invest in those programs. We have to look at bringing new specialists, opening new clinics, and those types of things.
Yeah. Well, and speaking of, we just had an event last week with you guys in terms to specialty health care being brought into our area. The Chamber had the pleasure of hosting a ribbon cutting for the new heart and vascular and transplant clinic that will open in October, which is tremendously exciting. Can you tell us a little bit about what will take place there, and more importantly, what's that impact to our region here?
Yeah, it's one of the first fulfillments of the promise that we're making to bring new resources to the community. We know, and I think all of you know, that the further you travel for needed health care, the harder it is, to do well. Right? The closer you are to your family, the closer you are to your support mechanisms, the better that you do. So it's vital for us to bring the care that we have in Atlanta closer here, to folks. So the clinic that we opened is going to rotate subspecialists through both transplants, solid organ transplants, so liver, kidney, heart transplant. People will be able to access those transplant specialists before they need a transplant, afterward. Work with the specialists in the community to make sure that we're setting things up appropriately. Heart specialists will be coming into the community. These are specialists that don't exist here that will support, you know, the cardiology community that, you know, is here, you know, in the community. So our hope, you know, is that, you know, we will have not only a flow of you know, providers coming here, but, you know, we'll have a very robust schedule. We're going to start off, you know, with transplant, you know, folks starting, frankly, next week, you know, and then building, you know, over time. But the whole idea is to bring more complex care here to the community so people don't have to drive to Atlanta.
What is your timeline or vision, if you will, on additional specialties in the area?
Well, we're in the middle of recruiting many of those specialties right now, you know, ranging, you know, from urologists, neurologists. We are looking at, you know, specialists, you know, in the broader region, you know, and in the middle of discussing how we perhaps can acquire those practices and relocate them here. So the short answer is we've been working on that for over a year now.
Yeah.
And we are, you know, in the middle of, and in some cases, closing some of those, you know, conversations where we expect very soon to be having announcements of, you know, brand new specialties that have never been here before, starting, you know, relatively soon. Now, one of the challenges that we have, and I'm looking to the team, you know, is that as we bring in more specialists and specialties that haven't been here, we have to be ready for it. There's a level of complexity of care that we need to make room for. So today, you know, our operating rooms in Warner Robins, about 2/3 of the cases in those operating rooms is outpatient surgery or colonoscopies, which is fine. But if we're going to bring in more complex specialties, we need to make room for that. So we need to better utilize peri. We need to better utilize our ambulatory surgery centers. We need to better utilize our endoscopy suites, and we need to train people because there are levels of complexity that our staff haven't seen, but we've got all that expertise in Atlanta. So, you know, we can train people, bring people into Atlanta, and get them up to speed. So there's a fair amount of work that we have to do, you know, to be ready for that growth.
Yeah, definitely work, but exciting work. And I know one of the big opportunities there is the investment in technology that's going to be needed in order for all of these healthcare providers to work optimally. And you mentioned Epic a little earlier, so let's talk about that and how that will improve coordination of care for patients.
Yeah, so these days, the electronic health record is critical to how a health system works. So, you know, we tend to think of medical records as big folders of paper and, you know, big file cabinets. Electronic health records these days are the backbone, you know, of how a health system works. So a doctor places an order, that order passes to the nurses activate the orders go instantly to the pharmacy knows, you know, what, you know, drugs to prepare, what to fill. I mean, all of those things, you know, happen, you know, now seamlessly. The health record that we currently have, you know, in our hospital is antiquated. In many cases doesn't have that seamless flow of information. Has, you know, in some cases, you know, we're recording things in paper and then copying that paper into the health record for a permanent review. I look to my anesthesia colleagues. You know, our anesthesia folks today document everything manually, and then we put it into the health record, you know, as a scanned, you know, document. All of those things will be automated. There will be, you know, artificial intelligence that is looking at what's going in and making sure that, you know, it's accurate. So the ability for, you know, us when we're ordering a medication to instantly know whether there's a contraindication to that medication or not, and those types of things are built into a modern health record. We today have systems, you know, I mentioned, you know, manual systems, you know, for, you know, things like anesthesia documentation, but our entire billing process at this point that lack of automation, is such that we today spend over $5 million a year in vendors to help us with a manual process. Right? So implementing a record that will now seamlessly pass that information, not only provides, a better flow of information, a better, and safer environment, but will also allow us, to save a fair amount of money. The other thing is that, people often think about, if you're going to make an investment, Epic is a $60 million investment, for us. What are the trade-offs? Right? In this particular case, this is table stakes. There really is no trade-off, to this investment. This is what we need to, have a modern, health system. The version of Epic that we're installing is the same version, with Emory, in Atlanta. So we'll have a seamless interface with all of our, Atlanta colleagues and all of our specialists. We also will have tools that, frankly, are pretty cool. So there's a component, the health record that will have something called ambient listening. And ambient listening, is a system where a provider can walk into a room. The ambient listening will be able to record everything that's in the conversation between the provider and the patient. Knows what's casual talk and knows what's medically relevant. And when the provider exits the room, all the documentation is in the record. All the orders have been set up. Everything's ready to go, and the provider just has to verify, that it is accurate. And the accuracy is about 99.99999%, accurate. So today, providers are often having that conversation, and then leaving the room, and then entering in what the conversation was. Right? So for them to be able, to do that, and just verify it, is really life-changing, particularly if they're in such a busy time they have to come back an hour later, those types of things. So, the Epic, will change, a lot of the clinical flow, will change a lot of our business processes. It's the single largest investment, that we will make this year.
That's very exciting, and I actually want to ask you a follow-up, but I'm going to ask Ron if he will grab my phone. I realize that this clock has stopped up here. Speaking of technology, so I don't want to cut our conversation short, but I don't know how much time we have. So, perfect. So I thought 15 minutes ago we were at 40, thanks to the clocks, but now I know we've still got 20 minutes, so I'm very excited about this. So, speaking of technology and training, those tools I know will be invaluable to the healthcare providers here in our system. With healthcare being such a people-centric industry, what additional ways is Emory investing and supporting those healthcare providers, the doctors, nurses, and medical staff?
So I think the biggest area is support are resources. So as I said, we've got tremendous folks. We've got a very, very solid medical staff. They haven't had the resources to be able to really provide the level of care, the complexity of care that we're looking to provide. So bringing resources to folks to be able to do their job and to do their job well is one. Two, we're really going to focus on investing in our folks. This next year, I mentioned that we inherited an organization losing $35 million a year. This next year, we project we'll lose $20 million. And the inside of that, we're going to be making a $13 million investment in people. So, we could move our turnaround faster, but we're choosing to make an investment in people. We're going to do that in 3 different ways. First, we're going to bring everyone to Emory benefits. So Emory benefits are significantly richer, than the benefits that House and Healthcare has had. So as of January 1st, everyone will have Emory benefits. Second, we are planning on a merit program so that, we will guarantee, we'll have a wage program that, will reward those people, who are exceeding expectations. And then the last is we will be starting a 4-phase process of implementing our wage philosophy. Emory's philosophy is that we will lead the market in pay. We will be asking people to do more than our competition. And we believe if we invest in people, they'll invest in us. So we will start a 4-phase program that will look at every job, and if we are behind the market, we will lead the market in that. So we're going to make that investment. We also have a tremendous amount of programs and resources, that folks in Atlanta are used to. People here in our health system have never experienced that type of support. And we'll be going through leadership training, we'll be going through experience training, quality safety training, all of those types of things, that an $8 billion organization is able to do professionally. This organization will tap into all of those types of programs. Excuse me. So really, there's a tremendous amount that we're investing in people, but I do think that at the end of the day, if we invest in our folks, right, they'll invest back in us.
I think you're right, and that sounds incredibly exciting. So I'm going to ask a selfish question for Jack and for many in the room, my daughter included, whose students are pursuing healthcare related fields. So what opportunities for local students or others entering the profession will there be, whether it's nursing or allied health or administration, for our young emerging students to come through and be part of the Emory story?
Well, Emory, has, our overall mission is to improve lives and provide hope. A big part of how we do that is not just the clinical care that we provide, but it's discovery of new knowledge, and it's focusing on training the next generation. So we will continue our commitment to our family medicine residency program. We have medical students, we have nursing students. So we will look to expand all of our educational programs and bring Emory programs here into this community. Today we have a relationship with other programs that aren't Emory programs. Over time, I think you'll expect to see that we have Emory programs in this community, and that's definitely part of our future plans.
Very good. So for many of us, the exposure that we'll have to Emory is either as a patient or a family or friend of a patient at Emory, either here or in Perry. And so what difference do you think that people will notice coming into the hospitals with their experience with Emory compared to the past?
So I think there's a couple of things that I would point to. So I mentioned our 911 response and the work and energy that we put it behind that. And I think it's a good example of what you as a community should expect. So as we became aware of the issue and really the critical nature of it, we brought a team down to do some work. We really brought experts with know-how. We brought resources. So we took a look at things comprehensively and realized we needed to pay people better. We needed to retain people better. We needed to give them an environment that they were, proud, to be a part of. We needed to upgrade a lot of the equipment, that they were working with. But we also needed to bring a different view of how we operate, the service, and how we interface that service with our own health system. So, today, I think we've seen dramatic changes in terms of our response time. I know that we've cut that in half, and we're down to, I think, about a 13-minute response time. It's still not where we'd like it to be, but it was over double that, which means there were plenty of cases in which, on an average, right, we were taking probably the better part of an hour or more to respond, to critical 911 calls. One of the measures that I'm most proud of, our team, and is something called wall time. So when an emergency crew brings a patient to the hospital, brings the patient to the emergency room, if we don't have a room available for that patient, then the team and the patient basically stand at the wall waiting for the health system to accept them. In January, if we added up all the hours that the team spent, at the wall, it was 5 24-hour days. So think about that for a minute. 5 full days, the team was taken out, of service, if you will, for the purposes, of responding. Last month, it was 18 hours. So that's a lot of work in terms of coordinating with the emergency room and doing other types of things. Fortunately, while we expected that we were going to, have the state looking further into, our emergency services, the state deferred. And I think that was in part because of all the work that we did, to be able to, start fixing those problems. But I think that's a good example of what this community should expect, that we'll bring the resources, we'll bring the know-how, to be able, to confront many of the problems that we need to fix, but also, to really, provide you what you deserve as a community. Second biggest area of concern was the emergency room. We know that we have to do better. I think in February, several of us took a tour of the Air Force Base, and the medical wing leadership told us flat out, we're going to just be honest with you, if there's an emergency of any of us on the base or our loved ones, we tell them to go to Macon. So that's not where we want our emergency room to be. Today, we are closing out an event that is designed to fundamentally rethink and redesign our emergency room. So we're using lean management principles, and we'll be installing a lean management system that will be focused on getting better every day. But later today, the leadership team, we will see the report out of the future vision of the emergency room, but more importantly, a calendar of events that will say every 30 days, this area that we're focusing on, we will make sure that we get through what we refer to as breakthrough performance, meaning 50% or better. Right? So wait times, people who are leaving without being seen, all of those types of things. Every month, we will expect to have a 50% improvement or better, and we'll make that standard work, and we'll move on to the next and the next. So I think your question about what should you expect to see, you should expect to see a much better emergency room, an emergency room that you're proud of, an emergency room that you won't have to bypass and go to Macon. And I think the other thing that I would say is we're going to get back to the experience. And there's a lot of reasons for that. It's not just what you are telling us in terms of your confidence. In healthcare, when we think of quality, we're measuring things like infection rates, bloodstream infection rates, things that have names associated that you wouldn't even recognize. And when they're at a certain percentage threshold, we know that it's good quality. Right? The data nationally shows that the community and the general public really determines quality based upon experience. So when our experience is in the 12th percentile, you're telling us that you have questions about our quality. And even though our quality could be technically pretty good, which it is, if we're not delivering an experience that you're proud of, you have doubts about us. So our commitment is that you will see a much different experience. you will see providers communicating with each other. You will see providers smiling. You will see providers, who will take the extra minute and ask, what else can I do for you? Even if it has nothing to do, with, the healthcare, that they're rendering. That's one of our most important jobs over these next couple of months, which is to deliver much better experience.
That's truly exciting. I don't know about the rest of you, but they have had an incredibly busy 90 days, and it's so encouraging. I think many of us, or all of us in the room, anticipated the arrival of Emory Healthcare with experiences that we have either had firsthand or knew about, because the reputation of Emory is something to be proud of and something that certainly stands on its own. And it is really exciting to see how that is already becoming the standard here in Houston County. And I hope you all are proud of that and as excited as I am about the bright future ahead. So let's shift outside of the hospital walls real quick and just, if you can share with us, I think we've got a good handle on how well we're adjusting here and working inside the hospital walls. And so looking a little bit more external, which is probably in another phase, but how do you see Emory engaging in the community, both in the immediate future and then long term? What will that difference look like?
So I've been to many different venues, whether they be Kiwanis clubs, whether they be Rotaries, retired communities and those types of things. One of my promises and Emory's promise, is that we will be completely transparent in terms of where we are, where we're going, how we're going to get there. So we will continue that. And I think it's important for all of you to continue to hear, where are we in the turnaround? We believe that, if we stay focused, on growth, we stay focused on becoming more efficient, that we'll be able to, affect that turnaround in 18 months. That's important for a lot of reasons. I was at the Economic Development Council board meeting, earlier, I think it was last week, and to listen to the number of companies that are investing billions of dollars into this region, meaning there will be people a workforce that needs to be recruited, right? The promise that we, will continue to deliver is that as a healthcare system, we need to catch up to you as a community. Today, as a community, you've done a terrific job investing in all the infrastructure for that type of growth. Healthcare has lagged. True economic development, healthcare is an equal partner. And in many cases drives a lot of the reason why people will want to come to a community. So that's a big part, of how we're going to continue to contribute, and bringing, new resources, new programs, new talent, to the region. I know that the leadership of the base shared with me that they're in global competition for talent to bring to the base, and in the past they have not been able to bring in the talent that they wanted because there were too many gaps in the healthcare system here locally, and that they cannot transfer someone in who has medical needs that can't be met within the immediate community. So that's a huge part, of the role, that we need to play.
Very good. So lastly, Kevin, you've got a room full of community champions who want to see that bright future that you're sharing about Emory. What message do you want us to leave us with? How can we support you in this next step?
Well, I hope you hear the optimistic view that we have, the pride that we have, now being a part, of the community here, and the role and how excited we are to play that role in growing this community. There is something that we need help with, right? So we need to bring in, more specialists into this community. This health system has had a hard time recruiting people, into this community. Many of the medical professionals that we're recruiting have choices 8, 10 different places to look at. And I believe that this community can do a better job of packaging what's here to communities outside of here. I hear frequently when I talk to leaders about how this is the best kept secret in Georgia, Central Georgia, right? We don't be a secret, right? We need to bring people here and confirm with them that this is a wonderful place to be and a wonderful place. We need to get away from bringing people here to try to convince them. So partnership with the chamber, partnership with the school district, partnership with the Economic Development Council, their work-ready programs, all those types of things. We need to package things differently. I can tell you personally, when I was on a Zoom call with June Lee, a little over a year and a half ago, and he mentioned Warner Robins, Georgia. I'd never heard of it. Sitting in Providence, Rhode Island. And so I Googled it. And I shared this with folks, right? As I clicked through, right? I saw Mayberry, right? There were wonderful things associated with Mayberry, right? But I think we want to package ourselves in a way in which we click through and we see a school district second to none. The investment that's taking place in this community and all the resources, what's here. The cost of living is low, for the quality of life, that is here. So my ask, is that we all figure out a way to package that differently, because with that, I think Emory, the resources we have, the reach that we have, the brand that we have, we will be able to much more effectively bring those medical resources to this community.
Kevin, thank you so much. It's been exciting to hear from you. Y'all join me in thanking Kevin for spending the day with us. Just a couple of announcements as we close. There's some important dates listed on your tables there. Our joint business after hours with the Perry Chamber is coming up on Thursday the 16th. You'll want to make sure to join us at House and Lake Country Club for that. And then on the 20th, we've got our Chamber Golf Classic. We do have a couple of team spots left. If you're interested in playing, please let Arlie know before you leave, because we're finalizing that this week. And we'll be back here on the 22nd for our Robbins Works Outlook. That's going to be an incredible opportunity. We will hear from Georgia Department of Labor Commissioner Barbara Rivera-Holmes and Georgia Ag Commissioner Tyler Harper, along with Mayor Walker and Scott Free and Sarah Murph about the future of workforce, all the things like housing and the other factors in the community that are a vital part of recruiting and retaining the talent that we need. You got an email from us yesterday stating that our Leadership Robbins class applications are open for 2026. As of walking into this meeting, we only have 8 slots left out of the 25. So if you have someone in your organization you'd like to send them through, please have them submit their application today. It is a first come, first serve and one per organization, but what an incredible problem to have with that program filling up so quickly. And speaking of filling up quickly, I think we've got the annual meeting slide with the QR code. As of this morning, we've already sold over 250 tickets to our annual meeting extravaganza, where we will celebrate the fact that there is no place like home. And I encourage you all to get your table or your box today, because those will sell out, but we are excited to expand our capacity. And yes, that is a Wizard of Oz wicked, all the things theme this year that you have to look forward to. And if you've been before, it's the biggest celebration of the year, where we highlight the individuals and businesses that make our community great. And then finally, we'll see you back here on November the 13th for our Military and Veterans Affairs Exit Issues. John Kubinik will be moderating that with some of our partner agencies, and we're looking forward to a great opportunity to round out Exit Issues. That said, Chuck's not going to be here next month, so let's all give a round of applause for that. It was also his birthday, in case you didn't know, so make sure you stop by, get a picture with the button. It's one for the record. Sorry. Thank you guys so much. We'll see you next time.